Pediatric Pharmacokinetics. Before birth, most drugs taken by the mother can reach the developing fetus. The placenta functions like any other maternal organ in absorbing and distributing drugs throughout the body. It is strongly recommended to avoid drug use during pregnancy, particularly in the first trimester, when the fetus's organs are still forming. Certain medications, known as teratogens, can cause serious harm such as spontaneous abortion, growth retardation, congenital malformations, or even cancer later in life. To help guide medications safely, the FDA has established the Pregnancy and Lactation Labeling Rule, also known as the PLLR. If you heard of the pregnancy categories A, B, C, D, and X, those are not supposed to be in use anymore, but you still might come across them. This new labeling system describes potential risks in greater detail. For example, acetaminophen or Tylenol has historically been labeled as Category B, but now it's just discussed as a low risk to the fetus and to talk with a physician before taking. After birth, some medications can still be transferred through breast milk. However, due to limited research and inconsistent data, it is generally recommended to avoid unnecessary medicines while nursing. Infants can still experience the same pharmacologic effects as the mother, but it is reasonable to consult a physician and reputable resources for the safety of a drug. It is important to remember that children are not simply small adults. Pediatric drug dosing must consider multiple factors beyond weight, including differences in body composition, organ maturity, and metabolism. Let's talk about absorption. In infants, intramuscular or IM drug absorption is variable and often slower due to limited muscle mass and reduced activity. Also, topical medications are absorbed more quickly and completely because of the infant's thin and highly permeable skin. In distribution, infants have a higher percentage of body water and less fat, which affects how those drugs are distributed. Lipid-soluble drugs like fentanyl may remain longer in the system, while water-soluble drugs are more widely distributed, which often results in lower blood concentrations. Dehydration from vomiting or diarrhea can quickly increase drug levels and intensify effects. Additionally, infants have lower plasma protein levels, reducing protein binding and increasing the amount of free and active drug in circulation. Drug metabolism and elimination are slower in infants, especially those under 1 year old. Immature liver and kidney function delay drug breakdown and excretion, leading to prolonged drug effects and increased risk of toxicity.